Hi, my name is Cassey Hall, and this is my head-to-toe assessment. This is Tori. She agreed to be my patient. Prior to entering the room, I washed my hands. I had her empty her bladder and put on a gown, but for today's assessment, she's wearing a tank top and shorts. Prior to the exam, I also got a full set of vital signs, along with her height and weight, and we did her far vision test with the Snellen and her near vision test with the Rosenberg. I will begin my assessment with the head and face. Her facial features are symmetrical. Her skull is round. Her hair appears evenly distributed and is blonde in color. No obvious bald spots or loss of hair. I will then begin by asking her to perform a series of neuro exams. If you could clench your teeth and smile, and then frown, puff your cheeks out, raise your eyebrows, clench them shut, stick out your tongue and move it side to side, and then shrug your shoulders. Okay, and that looks good. So I'll begin by palpating her scalp and her head, her skull, for any crepitus or deformities, and then feel her hair. It is soft, somewhat coarse, not oily, not brittle, and it is evenly distributed throughout the head. And then I'll move to her facial bones, and looking for any kind of crepitus or deformities. I will have her open her mouth closed, and while I feel her TMJ for any kind of popping or crepitus, and none was felt. And then I will move to her sinuses. We'll do her frontal, checking for any swelling, and her maxillary, checking for any swelling, and none is felt. I will then move to her eyes, and I will first check to see if they're symmetrical with the face, and they are. Her eyebrows are full, her eyelashes are full. I will inspect her irises. They are blue, no injuries. Her sclera are white, free of any redness or irritation, as well as her conjunctiva are pink and moist, no irritation, dryness, or swelling. I will then palpate her lacrimal apparatus, and it is smooth, no bumps, abnormalities, cracks, anything like that. And then I'll move on to check her pupillary response to light and accommodation. Just look at me. I'm going to shine this light in your eyes and check and see if your pupils respond, and they do on both sides equally. Okay, and then I'm going to shine the light on the bridge of her nose to see if her pupils respond to that light as well, and it does. Now I'm going to have you keep your head straight. I'm going to have you follow my pen line, and we're going to check your eye movement. And that all works well. And now with you're going to keep your eyes and your head straight and just focus on my nose, and I'm going to see if you can see my fingers in your peripheral vision.
Yes.
Okay, and now I'm going to have you cover your right eye and tell me when you see my finger come into your vision. Okay, now your other eye.
I see it.
Okay, and now we will move on to her ears, and they are both pierced, but otherwise clear, pink, no abrasions, no swelling. I'm going to, and they are symmetrical, the tops of her ears are symmetrical with the bottoms of her eyes. And I'm going to palpate her ear, her auricular. And they are smooth and soft, no bumps, crevices, cracks, anything like that. Now I'm going to perform the whisper test, where I'm going to whisper with my hand closed on both sides, and you tell me the word that I whisper.
Purple. Red.
Okay, and now I'm going to perform the Rhine test, and it is to test your bone and your air conductivity. So I'm going to hit it, and then I'm going to put it on your mastoid bone, and you tell me when you hear it stop, and then I'll move it 1 to 2 centimeters in front of your ear, and you tell me when you hear it lose the vibration. Okay, and then I'm going to do the Weber test and do the same thing, but it's going to be on top of your head, and you're going to tell me if you hear it in one ear or the other or both.
Both.
Okay, good. Now I'm going to move to her nose, and it is symmetrical in her face, located medially. And there's no abrasions, no deviations. It is pink in color. I'm going to have her tilt her head back. Her septum is medial and in between the nostrils, equally, no deviations or shifting. I'm going to check inside of her nostrils and check her mucous membranes and see if they're pink, irritated, or any kind of drainage, and they're clear. And then I'll palpate her nose. And it is smooth, no irritations or lumps. And I'm going to occlude one nostril and then the other to check her nostril openings. Take a big deep breath, or patency. Okay. Now the other one. And you could breathe good with both nostrils? Mm-hmm. Okay. Okay, now I'll move to her mouth. And I'll first, it is central on the face. It's symmetrical. The lips are pink and plush. No cracks seen, no dryness. I'll palpate. No cracks, it's soft. Now I'll have her open her mouth, big and wide. I'll check her buccal mucosa. I'll check her gums, her soft and hard palate. You lift your tongue out, the floor of her mouth. All is pink, moist, free of irritation or ulcers. Now I'll have her stick her tongue out and I'll check her pharynx, as well as her pilars, her uvula, her tonsils, her pharynx, and it is pink, free of any white patchy areas, swelling, irritation. Then I'll have her stick her tongue out again, and I'll check her tongue, make sure it's pink, free of any indentations, it's equal, round, she can move it freely. Okay, and then I'm going to check her gag reflex. You stick your tongue out. Okay, and it is present, and I'll have her say ah, and I'll watch her soft palate move up and down. Okay, and that looks good. She has, open your mouth one more time. She has 31 teeth, and they are white, and there is 2 dental caries that I have noticed. Now I'll move on to her neck. Over your hair. And it is symmetrical on both sides, free of any pulsations or enlargements or swelling. No JVD. Her trachea is midline. I'm going to first start by palpating her skin. It is pink, warm. I'm going to check her carotid pulses one at a time. Just check for strength, regularity, and that they are strong. And then I'm going to check her lymph nodes with her preauricular, her postauricular, her tonsillar, her submental, her submandible. Then we'll move down for her posterior clavicular chain, her occipital, the superior cervical chain, her deep chain, and subclavicular. Okay, and then I'm going to palpate her trachea and her thyroid and have her swallow. Okay, and I'm checking for any nodules or crepitus or enlargement, and none is felt. Then I will listen to her carotid and her trachea with the bell of my stethoscope for any bruise. If you could just hold your breath for just a second. And no bruise are noted. Now I will move down to her upper extremities. I'll have you move your arms out for me. First I'm going to inspect her skin. It is pink. No bruising, injuries, deformities are noted. I will then palpate her hands, starting with her hands. And they feel warm, dry. Her fingernails are pink, smooth, and her capillary fill is brisk and less than 3. And I'm just feeling for muscle mass, deformity, crepitus, anything like that. Then I'm going to go down to her radial pulses. Her pulses are 2+, strong, and bilateral. Her brachials, they're also 2+ and equal. And then I will have her, as I'm up here, I'm going to actually palpate her axillary lymph nodes. And then I'm going to have you shrug your shoulders and kind of rotate them. Okay. Now put your arms back out, and I'm going to have you move them up against my hands. Okay, now move them down. And that tests that muscle strength. Okay, and now move, shrug your shoulders against my hands. Good. Okay, now I'm going to move to her back. Okay, I'm just going to raise her shirt up. And we're checking her skin, inspecting her skin, make sure it's symmetrical, it's pink in color. I'll palpate her temperature. It is warm to touch, no diaphoresis. And then costovertebral angles down here, CVA, I'm going to palpate them first for any soreness, painful stimuli, and I'm going to percuss them. But did that hurt? Okay, so no pain. And then I'm going to move to her posterior chest, and you can just stay there. And begin with inspection. Again, it's pink, equal, symmetrical. Watch your respiratory pattern. It is equal, less than 18. No accessory muscle use or respiratory distress. And then I'm going to palpate and make sure that everything feels okay. And then I'm going to percuss, and you should hear resonance. And then I'm going to pull her shirt up, and I'm going to percuss for diaphragmatic excursion. So I want you to take a big deep breath and hold it. Okay. Okay, and then I'm going to have you breathe a few big deep breaths. And on that third one, I want you to hold it again. Okay. And I'm checking for the change in sound. And it's about 2 to 3 centimeters. Now I'm going to also percuss your lateral chest. You should also hear the resonance. Okay. Now I'm going to listen to her posterior and her lateral, then I'll switch her around and we'll do her anterior chest. Okay. Big deep breath. In and out. You put your arms out for me. Big deep breath. To this one. Have you turn around and I'll check your anterior breath sounds. And I'm checking for any kind of rhonchi or crackles or whether her lung sounds are clear. Any grubs. Big deep breath. And her lung sounds are clear bilaterally and throughout all lung fields. And now I'm going to check her anterior chest. It is symmetrical. I don't see any heaves, pulsations. I'm going to also do her, I'll palpate and do her tactile dermatitis as well. So I'm going to have you say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and I'm going to palpate her precordial. And I'm going to locate her apical impulse. I'm going to check it with her carotid. And it is equal. I'm also going to percuss. You should also hear the same thing at the back, that resonance. Okay. Now I'm going to listen to her heart sounds. We'll begin with her apical. Go up to her pulmonic. Herbs plate. Tricuspid. And her mitral. I heard S1, S2, no extra beats, no rubs, no clicks, anything like that. Now I'm going to have her move to the bed over here and lay on your back. We're going to check her abdomen. I'm going to lift her shirt up just underneath her bra line and kind of bring her pants down just a little bit right there. And first we're going to inspect, make sure we're equal. You don't see any kind of pulsations, masses, movement that shouldn't be there besides her breath sound, her breath movements. I will begin by listening this time instead of percussing, so we don't add any extra vowel sounds that aren't supposed to be there in all 4 quads. Then I'll use the bell and I will listen for aortic pulse. And then her renal arteries. And then her iliac arteries. And then her femoral. Okay. And those are active. I heard gurgling in her bowel sounds, and I did not hear any thrills or bruits in her arteries. And now I'm going to begin with palpation. We'll do, or actually I'll hear percussion, and we'll percuss throughout the abdomen, and you'll hear dullness over organs and tympany over air-filled spaces. And I'm going to do her liver borders. Percuss up until it changes. Let me grab my pen. Okay, and then we'll go work our way down until it changes as well. It's about 3 centimeters. And then we'll come over here and we'll percuss her splenic borders. And then we'll palpate. And we're going to just do small, light palpation at first, looking for any tumors or growths or enlarged organs. And then we'll do deep palpation, and you're looking for your liver border and your spleen. Okay, and then you want to check the kidneys, left kidney, the right kidney. And then you're going to go down the center and pull and enlargements and have her lift her head up just a little bit. and you'll palpate her muscles. Okay, now I'm going to have you come back up here and sit on the, while I check your extremities. Okay. Her legs are equal, pink in color, hair's evenly distributed, no swelling. I'm going to palpate her legs for muscle mass, swelling, any edema. No edema. Her legs are smooth. They're warm to touch. I'm going to check her popliteal pulses. And they're check for strength, regularity, and they're strong, 2+. Or dorsalis pedis, or I mean her post tibs, and they're strong, 2+ as well. And then her dorsalis pedis, and they're strong, 2+ as well. And then I'm going to check her her strength. I have you bring your legs up for me. I want you to put them down with my resistance, against my resistance. Okay, now go up. I'll do that with your feet as well. Okay, and up towards your head. There you go. Okay, now I'll check her reflexes while she's there. First we're going to do your knees. And they're good and reactive, not too reactive. Her Achilles. Okay, and then we'll move back up and do her brachials. Just gonna have you go, let them go web. Okay. Over here. Okay. Now I'm going to perform some neuro exams on her. We'll do the sensation. I want you to tell me if you feel it on both sides of your, where I put it on your face. We'll do it on your arms and your legs. You feel that?
I felt them both. Both.
Okay.
Both of them.
Okay. I'm going to have you stand up. I want you to put your arms to your side, stand straight, and close your eyes. Okay. Okay, now I'm going to open your eyes back up. I'm going to have you stand on one leg, close your eyes. Okay, sometimes there's a little swaying, but not too bad. Now I want to have you walk heel to toe, just a couple steps. I'll turn around to do that again. Okay, now I'm going to have you turn around. I'm going to check your back. Can you bend over for me? I'm just checking her spine, her cervical spine. Just palpate it. For any lumps, nodules, curvaceous. And it's pink, it's straight. Okay, you can stand up. And that ends my head to toe assessment. Thank you.